Welcome back to Mental Health Awareness. I'm Larissa Russell. In part one, we talked about what is mental health and why it is important to talk about mental health just like we would physical health. We identified what impacts mental health, normal adolescent development, and warning signs or red flags that you should be aware of. We are now moving into part two, supports and resources. Resources to support and inspire your mental health work. It is important to note that managing mental health, along with recovery, is possible with the right resources and supports. Remember, the earlier an intervention begins, the more likely a positive outcome. Know when to seek help. Emergency help, such as crisis or 911, should be sought if there's physical distress, such as chest pain, trouble breathing, fainting, or cognitive impairment such as disorientation, confusion, or slurred speech. As stated in part one, you may not know if what you are observing is due to a mental health concern or a physical health problem. Medical attention should be sought immediately. In school, this first step may be notifying the nurse for assistance and allowing him or her to evaluate the situation. If there are threats of violence towards oneself or others, maybe physical or verbal, emergency help should be sought, or someone in the building that can help you determine if emergency help needs to be sought. If there's suicidal ideation and or such behaviors, this might be something that you read or see even through a drawing. If you see something like this, report it immediately because emergency help may be needed. If there are signs of self-mutilation such as cutting, this could lead to severe consequences such as an infection or even death, even though that might not be the intention. If there's suspicion of drug or alcohol use or overdose, you should report it immediately and get emergency help. Let's talk about other mental health resources and supports that can be used when it's not an emergency. In school, you might have a school counselor, school social worker, a nurse, or even the Student Assistance Program as supports. The Student Assistance Program is a team approach to identify any needs and refer for assessments and services. Crisis intervention could also be utilized in a non-emergency situation because you would be able to talk through the situation and they would be able to help you determine what other interventions might be needed. Many families prefer to go through a primary care physician or a pediatrician as their first step. This is very common because a primary care physician or a pediatrician could also talk with the family about other supports. There are psychiatrists and psychologists. The primary difference is that a psychiatrist can evaluate and prescribe medications for mental health issues, whereas a psychologist would most likely evaluate, provide counseling, or refer for other needed services. In Schuylkill County, we have a variety of community resources for mental health support. Some of these include SAM, which is Service Access and Management. This agency provides case management services for mental health issues. It helps the family determine the best needed supports and resources. And if something is working or is not working, they can help with other referrals. There's drug and alcohol providers. There's also outpatient providers that could provide counseling, family therapy, or other forms of support. Some families prefer to go through religious or church affiliations. Many churches offer support groups for their families or information on how to get support. There are also various other support groups in our community for drug and alcohol and mental health issues. There are also some that provide support groups for specific diagnoses, such as autism. Let's go over some tips for you as paraprofessionals. It is important to review the school policies on mental health, crisis intervention, suicide awareness, and suicide prevention, and also your role as a mandated reporter. It is so important for you to know your boundaries and the protocols within your schools. If you notice something of concern, please report it to your classroom teacher, school social worker, or administrative staff. Again, this is where your school policies might help you even identify who you should report it to. Get to know who is on your student assistance program team. They are a valuable resource for helping students in need of mental health supports. Do not be afraid to seek assistance in uncomfortable situations. Not everyone is okay with helping someone needing mental health support. Find someone who will help, but do not leave the student alone. That is probably the most important part of this tip sheet, is do not leave the student alone until other help arrives. Students may feel comfortable opening up to you. They may trust you and seek you out to talk to. Just be prepared if you need to report concerns, and be honest with the students that you may have to report your concerns. Remember, you are a support and you are a resource in your position. You are not a therapist, but you still can be supportive. Take a look at this cartoon, and what do you see? Imagine how this student's mental health might be impacted by these issues. I'm sure you can think of several other issues that could go on these luggage pieces that would be impacting this student's mental health. Now think about how all of this would impact their education. Do you really think he's concentrating on math class if all of these other things are going on in his life? As we conclude part 2 of mental health awareness, think about how resources and supports can help this student, which in turn can also help with his educational success. Remember, you could be that one person to see a concern, refer for help and support, and help that student manage their mental health and even be on the road to recovery. We are now concluding part 2, supports and resources. Please take the time now to complete the questions for part 2. Thank you.